Hi guys, and welcome back. Today's lesson is going to be talking about home care products. So we're just going to be talking about different products that you can get at your pharmacy or your grocery store and help you alleviate any symptoms, prevent cavities, help dry mouth, and everything like that. Okay?
So first off, thank you so much for participating in our research model. The purpose of this research model is to study the association between dialysis treatment and oral health. All of the information collected from the surveys will remain confidential. The program will consist of 4 virtual lesson plans and 2 surveys per lesson. One before the lesson is delivered and one after. While personal information, such as your name or address, will not be collected, the surveys may include questions regarding demographics. The surveys will be collected from a third party once completed to further ensure that your identity remains anonymous. Participation in this study model is completely voluntary, and the participant may withdraw at any time. Your completion of the survey will be considered your consent to use the information provided for our research model. Thank you.
So at the end of today's lesson plan, you should be able to understand the risks of dry mouth on the oral health. You should be able to state the different categories of the products used for dry mouth relief. You should be able to identify different examples of products for each category of dry mouth. Know how long and how often to use each product, and be able to select the benefits of using denture adhesive products.
Hi, so with end-stage renal disease, as many of you may already be aware, you can have a lot of negative symptoms from it in your mouth. One of those being a reduction of saliva production. So a lot of you may notice that you may be experiencing more of a dry mouth, and that's pretty common. With the dry mouth, however, you can have other things such as the cavities, gum disease, and fungal infections. The reason for this is that saliva basically helps protect our mouth from a lot of bacteria. It helps keep it nice and moist, so that we're not uncomfortable, and it helps basically just carry nutrients all over our mouth and to our gums, to our teeth. So it has a lot of good benefits. However, as we mentioned, with the end-stage renal failure or the dialysis treatment, you may be experiencing lower levels of saliva production, and therefore the dry mouth, the cavities, the gum disease, and the fungal infections. So we're going to go ahead and talk about the benefits of using products such as lubricants or saliva stimulators to help alleviate the symptoms and protect your mouth. So one thing to note about all the products that we're going to be talking about today, a lot of these products, not all of them, but a lot of them can be found at your local drugstore or grocery store. So places like Walmart, Walgreens, even Food Lion. Also, they come in different forms, and we're going to talk about each form in detail. They may come in gels, oral rinses, sprays, chewing gums, and mints or lozenges. In addition to that, I just wanted to mention that even though we're going to be showing some example of products, the availability of these products is not limited to what we show. So you might see other brands in your local store, and those may work just as fine. Okay, well, let's get started. So starting with the gels are great because they help lock in the moisture. So this helps soothe and protect your gum tissue. They are alcohol free, and they work for about 4 hours. They're portable, so they're small and easy to carry with you. They're good for on the go. You can always, whenever you feel like your mouth is starting to feel dry, you can just pop it out and use it right then and there. The way to use it is that you will squeeze the tube and place about 1/2 inch directly on your tongue, and then you'll use your tongue to spread it all over your mouth. So these are not harmful to swallow. So if you're pretty generous and you swallow a little bit, that is fine. It won't harm you. And right here we have a couple of examples. So we have the GC Dry Mouth Gel. This is one that you may not find in your local store. This is more of an online product. But the Biotene right here is one of the more known products that you can find at your local store. And we'll talk a lot more about other Biotene products, such as the rinses. So these are just a couple, like I said, of the examples. If you search for other brands, you can probably find a lot of other gels that will work just fine. Next, we're going to talk about the rinses. So the rinses provide more of an immediate relief. So from the discomfort of the dryness, they are used with home care products. So they're mostly used when you're done flossing and brushing. You're going to go ahead and use this as a mouth rinse after. You can do it at the beginning of the day and at night before going to bed. And you can also use the mouth rinse in between throughout the day if you feel that you need it. You want to use it no more than 5 times per day. But if you want to use it about 3 to 5 times per day, that is fine. The biggest difference with this and the gel is that you do not want to swallow this. The gel is safe to swallow. These are not. And the way to use is that you're going to have about 15 milliliters of the solution. You're going to go ahead and pour that into your mouth and you swish it around for about 30 seconds and then spit it out. So just so you can get an idea, 15 milliliters is about as much as this cup, okay? A little bit under. This right here says 15 milliliters if you're able to see. All right. So remember that with these products, you want to be very generous. So just a little bit. You want to make sure that it's enough to coat your entire mouth and provide that barrier and that lubrication. So right here we have a couple of the products. Once again, we have Biotene. This time it's in an oral rinse form. We have Colgate Hydrus, and we have Act Dry Mouth. And like we said, these are not the only products available, but these are one of the ones that you may see at your local store. So another form of the mouth lubricants that you will find are the sprays. The sprays are great for on the go. They're also very small and portable. You can use them as needed. There's not really much of a limit. And they provide up to 4 hours of protection. So all you have to do is take the spray and just literally spray into your mouth. You want to make sure it covers pretty much all the surfaces in your mouth, the tongue, the gums, the cheek, and then after that you can maybe use your tongue to spread it out more. And it's also not harmful to swallow. So these are great to have and to carry with you all of the time. So we have the Biotene once again. Then here we have Lubricity, and then we have Spry. So another product that's very common are the chewing gums. So right here we have Act Dry Mouth Moisturizing Gum, and we have Spry. So even though these are different brands, they all pretty much contain the same active ingredient, which is xylitol. So xylitol is great because it is more of like a fake sugar or an alcohol sugar. And we'll talk about the benefits of that in a minute. So with chewing gums, so it soothes and protects your gum tissue. It stimulates saliva production. That's one of the differences between the other products that we talked about and the chewing gums, is that what this is doing is more of like stimulating for that saliva production in your mouth so that your own body is creating more saliva. It's sugar-free, so it provides anti-cavity protection, and it can be used up to 5 times per day. Now, as I mentioned earlier, with the xylitol, it does provide anti-cavity protection, and the reason being is that the xylitol is an alcohol sugar. This type of sugar, bacteria cannot use to basically live off of. All right, so when we eat a lot of sugar, a lot of the bacteria in our mouth uses that and it eats that up, and that's what it uses to survive. With xylitol, it'll eat it up thinking that it's sugar, but it's not sugar, so it will help kill some of that bacteria. So that's one of the greatest benefits of xylitol. And like I mentioned, we have Act and Spry here, but there are many other products that contain xylitol. And we'll talk about a couple of those in the next slide.
Another example of a product you can use for dry mouth is mints or lozenges, and there's a lot of different types out there. These are really, really easy. Just like gum, you can put these in your pocket or your purse on the go. Most of these, if not all of these, are sugar-free. They stimulate saliva production, so that helps to rinse out all that bacteria and excess food in your mouth. And a lot of them are anti-cavity protection, so that means that they protect from that bacteria that helps promote cavities. And up top you just see we have a few different examples of some of the products that you could find at your local drugstore or your grocery store. We have Thorough Breath, which is pretty popular, and these are lozenges. We have Spry, this is an example of the gum, but they also come in mints, and it looks just like that. And then Oral-B has moisturizing lozenges as well. So toothpaste, as we all know, is one of the most important products you can use to protect your oral health and promote health. So for you specifically, what we recommend is you want to look for products that have the term sensitivity or dry mouth on the product, and that will help, you know, in the selection process, because there's a lot of toothpaste out there and I know that it gets really confusing. You also want a fluoridated toothpaste, and most of them already have that, but you can see fluoride or fluoridated on the package when you buy it. Fluoride is really important in preventing cavities and relieving sensitivity. Some available at local stores, so like we said, you can get those at your drugstore or your grocery store, and then other ones are by prescription. So those are a higher concentration of fluoride that is recommended and prescribed by a dentist. And with this toothpaste, you're going to want to use a soft bristled brush. So when you go to the store and you're looking for a toothbrush, it's going to have either a big S on it or it's going to say soft bristle. So that's the one you want to grab. And in the next lesson plan, we're going to describe how to use all of these products, so stay tuned. Here are just some examples of the toothpaste that we were mentioning earlier. So as far as prescription toothpaste goes, this one on the far left is called Prevident 5000, and that is something only a dentist can prescribe to you. You can't get this anywhere else. The other two, these you can find at a local grocery store. And we have the Pronamel, Sensodyne Pronamel. So Sensodyne is the brand name and Pronamel is the product description. And that one has fluoride and should help with dry mouth. And then Biotene, we've seen Biotene has a lot of different products in a lot of different categories. They also have a toothpaste. So this one is, like it says right on the box, fluoridated toothpaste. And this is good for sensitivity, and it says #1 dentist recommended. That's great. For those of you that have fixed or removable dentures, complete dentures or partials, those are removable fake teeth that come in and out whenever you want. We have some products for you. As far as products go, these are oral adhesives. So basically you put them in between your denture and your mouth, either your gums, the floor of your mouth or the top, and that helps adhere it to your mouth instead of just relying on suction. So These oral adhesives are really good at gripping those dentures and holding them in place. They close up the space in between the denture and the base of your mouth to prevent food and debris from getting up in there. And this promotes the prevention of infections and irritants. If food and debris are allowed to get up underneath the denture, then it can cause fungal infections and can cause your gums to get red and inflamed. It provides comfort by providing that layer in between the denture and your mouth. It's like a cushion. And some of these products actually kill odor-causing bacteria. And bacteria is actually a huge promoter in bad breath, so it helps prevent that. We have here 2 examples of what we would use. We have Fixodent and Polygrip, and you can get either of these at your local drugstore or grocery store. As far as denture cleaning products go, we have a few examples of those as well. In general, a lot of them usually use the same components, but most of them, will say they kill about 99.9% of bacteria that cause odor. They reduce the plaque buildup, and they help to break down that tartar because, believe it or not, anything that you have in your mouth accumulates plaque and tartar the same as your teeth, so you still have to clean them. So it helps to break down that hard stuff so it's easier for you to remove. It dissolves tough stains in hard places. So if there's an area where you can't get to them with a brush, and hard stains usually caused by coffee, tea, wine, tobacco use, so smoking, anything like that. With these products, you definitely want to use them in combination with brushing. So we're going to talk about that in the next lesson plan, but using a denture brush to clean them after you soak them in these products. On these boxes, especially one of the examples, it will say you can use them daily, and that's fine. It's not going to harm the dentures, but you really don't need to use them more than 2 to 3 times a week. And using them weekly is also okay. But as long as you're cleaning them daily, once a day with especially a toothbrush and some soap, and like I said, we'll get to that in the next video, then you should be good. On the right side, you see we do have some examples of denture cleaning products. So we have Polydent is probably the most popular, and we have Effordent. And you're really just going to follow the directions as indicated on the box, but you're going to put them in a glass of warm water, a bowl of warm water, and then put the tablet in and let that soak for however long it says on the product. Okay.
All right, guys. Well, thank you so much for watching. This concludes our lesson for today. So we did talk about a lot of these over-the-counter products. You can go ahead and talk to your dental care provider, so your hygienist, your dentist, about some of these products if you're thinking of using them, or maybe they can even offer you products that they can prescribe and that might be more effective. If you have any questions or comments, please don't forget that you can always leave that at the end of the post test, which will be handed out to you shortly. And in our next lesson, we will be going into detail about how to better clean your mouth and how to basically oral hygiene instructions, where we're going to talk more about how to properly brush your teeth. And we're going to go ahead and go more into detail about how to use the denture cleaners that we talked about today. So we're actually going to be showing you. Thank you so much again, and have a good day.